Hello, so we're back again. So this time we're gonna do the cranial nerves assessment. Once again, I have Carmen here. She's my patient. She's gonna be my volunteered patient. Carmen, do you give me permission to show this to my school for educational purposes?
Yes.
So she is agreeing. She is over 18, so we're gonna go ahead and start. We're gonna start with the same process. I'm gonna go ahead and pretend that I'm walking out, and then I'm walking back in and knocking, and then I'll explain after that. So I am walking out, I'm walking back in, I'm knocking, knock, knock, knock. I come back in, I close the door for privacy. I introduce myself, and then, before that, I wash my hands for hygiene. Now I'm introducing myself. Hello, Carmen. My name's Jasmine. I'm a student nurse. I'm gonna have her. I'm gonna double verify her name and date of birth. Carmen, can you please tell me your name, your full name?
Yeah, my name is Carmen Saavedra.
And what's your date of birth?
January 14, 1975.
Good. Thank you. So at this point, I've already washed my hands. I've introduced myself. I've double verified that she is my patient, and we'll go ahead and start with the cranial nerve assessments. We're going to start with number 1, cranial nerve, which is the olfactory nerve, and that is we're checking for smell. So I'm going to have her tell me if she can smell. Okay, so we're gonna, as I said, we're gonna be testing the smell, the cranial nerve for smell. So I'm going to have you close your eyes, and then I'm gonna have you smell something, and let me know if you smell it, okay? Please close your eyes. Okay. Smell.
Yes, I smell it.
What is it?
It's a perfume.
Okay, good. Open your eyes. All right, so Carmen is able to smell, so we know that cranial nerve number 1 is intact. Now we're going to check for cranial nerve number 2, which is the optic nerve, and it measures visual acuity. So the way that I'm going to test this is I'm going to use a Snellen chart. I'm going to have her stand 20 feet away from it, and then I'm going to have her read the smallest letters on the chart. So if you can please stand up for me, Carmen. And we're going to step right there. We're about 20 feet from the Snellen chart, and I'm going to have her cover one eye and read the smallest line of the Snellen chart. Okay, so please cover your eye and read the smallest line on the Snellen chart. Okay. D, E, F, P, O, T, E, Z. Good, Carmen. Now can you cover your other eye and read the smallest line that you could see? D, E, F, P, O, T, E, C. All right. So Carmen was able to go ahead and sit down. She was able to read the smallest line, which it was the 2020. So it means that cranial nerve number 2 is intact. Now we're gonna check cranial nerve number 3, 4, and 6, which is the ocular motor, the tracheal, and the abducens nerve. And all of these nerves really are for eye movement. So for this, I will be assessing with the 6 cardinal fields of gaze. I'm going to have Carmen follow the pin light without moving her head, and just following the pin light, okay? So just follow the pin light, okay? Good, Carmen. All right, thank you, Carmen. So there's no nystagmus, no involuntary fluttering, and no strabism. So the next thing is I'm going to check for the pupil reflex. I'm going to do the direct indirect and accommodation. At this point, in a real setting, we would dim the room to make sure that we're doing it correctly, but here we're not going to do that because I can't do it. But I'm going to be using a pin light. So now I'm going to have Carmen stare straight ahead, and then I'm going to be checking for that pupil reflex. So can you just look straight? I'm going to be flashing a light to your eye. Good. 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 So, for accommodation, I'm gonna have Carmen stare straight ahead, and then I'm going to place the pin light in front, and I'm gonna have her follow the pin light. Okay. So now I'm gonna place this right here, and then just follow this. Okay. Just checking for accommodation. Good. So I was looking to see how well her pupils would fixate on the object and how well her pupils would constrict. So her pupils are equal, round, reactive to light, and accommodation, which means that cranial nerves 3, 4, and 6, which is the oculomotor, the trochlear, and the abducens, are intact. Now I'm going to be checking for cranial nerve number 5, the trigeminal. And here I'm going to be testing for a sensory function. So I'll have Carmen let me know if she feels where I'm touching. So Carmen, can you please close your eyes and let me know now once you feel me touching your face? All right. So can you tell me?
Yeah. 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 Yeah.
All right, so Carmen is able to feel the soft touch on both sides. Therefore, the sensory component is intact. So we know that cranial nerve number 5 is intact. Now I'm going to check the motor component by having Carmen open and close her jaw from side to side. And so can you open your mouth and move it from side to side? Good. So since she can move her jaw in all of those directions, we know that cranial 5 is intact. We're going to move on to cranial number 7, which is it's a cranial nerve for facial nerve and also taste. So we're going to start with the motor nerve, which is I'm going to have Carmen, please Carmen, close your eyes tight and open them wide. Like that. Good. Smile. Frown. And then puff your cheeks. Good. Now the next thing is I'm going to have you taste something. Close your eyes. And I'm going to have you taste something and then tell me if it's salty or sweet. So here you go. Take a test. Okay, you can open your eyes.
It's salty.
All right, good. So it is in fact salty. So thank you. So we know that cranial number 7 is intact for both motor and sensory. Now we're going to move on to cranial nerve number 8, which is the vestibulocochlear nerve, which is the auditory. So I'm going to have Carmen cover one of her ears, and then I'm going to whisper 3 words, and I'll see if she can tell me, repeat what I say. So cover your ear completely like that, and then let me know if you repeat what I say.
Yeah. 1, 2, 3.
Good. Now let's do it with the other ear.
1, 2, 3.
Yes. So she was able to hear correctly. All the whispers were heard bilaterally. So now we're gonna check the motor component of the cranial number 8, which is the rumbar test. So Carmen, I'm gonna have you stand up, and we're gonna check for balance. So close your eyes, put your feet together, and then I'm checking for balance right now. All right, good, Carmen. You can open your eyes and you can go ahead and sit down. I was observing for balance, which is really good. There's no swaying. So the rumbar test is negative, which means that it's normal. So cranial nerve number 8 is intact. We're going to move on to cranial nerve number 9 and 10, which it's the glossopharyngeal and the vagus nerve. I'm going to be using a pen light. So I'll be checking inside of your mouth. If you could please say ah.
Ah.
Ah again.
Ah.
Good. All right. So the uvula rises with pronunciation bilaterally. So we do know that cranial nerve 9 and 10 are intact. Now we're going to be moving to cranial number 11, which is the accessory cranial nerve. And this nerve gives you the ability to move your head from head and shoulders. So Carmen, can you please turn your head from side to side? To the other side. Can you look down and up? All right. Can you drop your ear to your shoulder? And then the next one. Can you shrug your shoulders? All right. So Carmen was able to do all of this for the range of motion movements. Now I'm going to check for the resistance part, which I'm going to have her shrug your shoulders up and then they'll let me push down. Good. So the resistance part is also good. She was able to hold her shoulders up while I was pushing down, which shows me that she has full strength against resistance. And for that, we know that cranial nerve number 11 is intact. We're going to move on to cranial number 12, which is the last one. And this is the hypoglossal nerve. Carmen, can you please stick your tongue out and move it from side to side, up and down? All right. Now, can you say light?
Light.
Tight?
Tight.
Dynamite?
Dynamite.
Good job. So Carmen was able to do this exercise, and that shows us that cranial nerve number 12 is intact. Thank you so much. Bye.